It's a little different shoulder, hip, and knee. So from a knee, it's very, very, I say labor intensive. So very time intensive with regards to therapy. So then for knee replacement patients, you've got to do your therapy, got to do your therapy, got to do your therapy. If you don't do it, it becomes a little more challenging on the rehab side. But for postoperative care, usually you're in the hospital. Sometimes same day, patients can go home. Sometimes it's the next day. We've had a lot of breakthroughs in pain management. Typically, for my practice, you will stay one night and then you go home the next day for the majority of patients, and then you leave. We send a therapist to your home to work with you for about 2 weeks or so, and then you start outpatient therapy. But I think physical therapy for knees is very, very important. For hips, hip replacements don't require as much therapy as a knee replacement patient. I tell my patients that walking is the biggest therapy that you can do after hip replacement. There are things that you can do with regards to the abductor muscle strength, so the side muscles on the hip that you can strengthen that help stabilize the pelvis. But usually within 2 weeks to 3 weeks, as I said, for hips, you're recovered. Shoulders are a little different. Shoulders are a little more labor intensive also. Could be you have to wear a pillow sling for about 4 to 6 weeks. Depends on the surgeon, depends on the type of surgery. But then usually you start therapy again. So usually about 3 months on the recovery. The biggest things for transition to home, assessing your home status, making sure you're safe in the home, having enough family members to help you. If you feel like going home is not a good alternative, then it may be something that you think about for a rehab or maybe a nursing facility to help you. But these are all discussions you have with your surgeon, your hospitalist, your nursing staff, and all of these things are worked out. You try to work all these things out in your joint class beforehand, so that the joint class that was mentioned earlier is a very important step in the overall return to activity.